Yes, with COVID-19 cases rising again, the Uttar Pradesh and Haryana governments have made masks mandatory in the districts surrounding Delhi, NCR region, in fact. Remember, UP and Haryana as well as Delhi had scrapped the fine for not wearing masks for public in the first week of April. However, with cases mounting, the fine is back. In UP, the mask mandate is back for Lucknow and 6 other districts. In Haryana, 4 districts have been flagged. The questions that we now need to address are, is getting rid of the mask a good idea? If yes, what about the rising cases and what happens to kids who are not inoculated yet? Joining us at this point live is Dr. Sanjeev Bagai, Chairman and MD, Nephron Clinic. We also have Dr. Mohsin Wali, cardiologist and physician, joining us live on the broadcast. Let me begin with you first, Dr. Wali. Your first comment on the mask mandate. Interestingly, now with the rising cases, certain states and districts making masks compulsory once again. Do you believe that that is a good idea? We should not have perhaps done away with the mask mandate in the first place?
Yes, when they had done it and they were trying to do it for the first of this month, I told that the administration is throwing the ball in our court, making us more sensible and making us more responsible. They are only removing the clause of fine. It does not mean that mask goes away. Mask should never go away. This is what I concluded, and I spoke also on your channel. And I was of the opinion that people will realize, and mostly people are realizing, that we should not have done away with the mask and COVID appropriate behavior. The most important thing is, at the same time, people have started indulging in functions, going out, making crowds, and our country is full of festivals. Every week there is one. And people are gathering, unexpectedly huge number people are gathering in. So all this combined, and then school were open at the corresponding point, and school children had started suffering after a period of 10 to 12 days. So this was very important side of the story, and this was never to be neglected. And now the wrong message has gone out that school should not have been opened. No. Schools should have been opened and appropriate COVID protocol should have been observed and distance should have been observed. Now, children are forced to do both offline, online. I am of the opinion that online classes should not be discontinued till we are fully satisfied. We do not want to make it Shanghai again. And our children should be secure. Then, question of vaccination, probably Dr. Bagai would be enlightening us 5 years above children who are not yet to be vaccinated, when and how soon they need vaccination. Of course, most of them are not going to school, but the adult children are getting vaccines. The elderly group and the adult group 18 plus are eligible for the booster doses. They are getting vaccines. Children above 12 are getting vaccines. So all these categories are being vaccinated, a good number of vaccines. Despite that, on Monday, we did 14,965 COVID jabs. And fourth wave scare has been spread. Fourth wave scare has been spread because new cases, like on Sunday, 517 fresh COVID. Positivity rising from 4.2 to 7.72. All this led to the meeting of Delhi Disaster Management Authority, and they considered, Health Ministry considered simultaneously. So what is happening is that we are not reversing the decision. Actually, this is a wrong notion to me. We have never asked people not to use mask. We have told them you will never be not be fined after this. So mask was not to be removed. Mask was not to be removed. Mask responsibility was thrown in our court, and mask is the only solution along with COVID appropriate behavior which will prevent us for future variants, future infections and future suffering. You see, apart from COVID, other infections too. So what I summarize here today is that perhaps it looks like we have taken a wrong decision. It looks like the decision had gone in jeopardy. We had stopped using mask. Yes, many people have stopped using mask, but it was never mandated to stop using mask. The only prominent part of the mandate was, since now we are announcing liberalization in the rule, the people will not be fined. So this ball was in our court. We have probably played less responsibly, and therefore this condition of what we are discussing today has arisen. So we have to go back to the COVID appropriate behavior.
Indeed. Let me in fact get in Dr. Bagai at this point as well. Dr. Bagai, what is your take on the mask versus no mask debate? Do you believe that mask mandates should not have been scrapped earlier? And looking at the rising cases, is it a good idea that certain states, certain districts are actually levying fines once again and asking people to mask up once again? Dr. Bagai, are you able to hear me? Okay, I think we've lost that connection with Dr. Bagai. Dr. Wali, quickly coming back to you at on the rising cases now in Delhi particularly, because overall, if we look at the country, no other state or district is as concerning as Delhi NCR just yet. Although Delhi NCR, of course, it's not a very abnormally high number as yet, but yes, a certain spike has indeed been seen in the last few days. What is causing it, according to you, and how should we prevent a further spike?
Yes, old strategy has to be followed. I must tell you that 141% rise as documented today in the UP and around UP in the Noida area. 1,188 patients as on now, as on this time, are under home isolation. So this is all ready with 136 centers which are testing. We have to do testing. Testing is the only way we can reach up to the grassroots level of the infection, from where the infection is arising and which variant. Of course, we are doing very strict genomic testing. So these both testing methods have to be combined and overall taken into the masses. And of course, we are getting less news these days because of the other news dominating. That's very important big factor to me. So people in isolation, people not much in hospitalization, that gives me a little relief to tell you on your channel, to the people also, they should not get into any panic. But testing is very important, and track the people, treat the people. Of course, they are not to be treated in ICUs, they are not to be admitted. So all this is happening very peacefully, but we have not to let the guard down. We have not to lose the guard. We have not to stop COVID appropriate behavior. This is the crux of the time, crux of the matter. Otherwise, we will suffer.
Yes, Dr. Wali, also as far as XE is concerned, what is your analysis of the XE variant, and what sort of impact could this have in India? Because we've seen that is the new variant that has wreaked a bit of havoc abroad. There have been a couple of cases reported of that in India too. Reportedly, the new cases in Delhi have been sent for genome sequencing. We'll get the results next week. What's your take on XE, Dr. Wali?
Most likely, the genomic sequencing you are talking from Delhi would come out to be a combination of basic ancestor 1, basic ancestor 2. We have discussed this, BA1 last time. So combination of BA1 and BA2 is this new strain, which you have said just now. And in Delhi also, it may be same, because 3 months back, it was seen in Europe. So this strain is a combination of basic ancestor BA1 and BA2 and is milder in affecting the system, but very rapid in spreading itself, about 10% more than what we had the previous one. So it is more rapidly spreading, more fast growing, we can say, and is relatively less lethal, and does not cause any ICU and hospital admissions, and does involve the upper part of the respiratory passages and not mainly lower respiratory passages. This is the difference, basic difference, clinical difference, and not much.
Yes, the concern though, Dr. Wali, remains children. Students at schools, because that's where a lot of infections have been reported, particularly the NCR region. Obviously, those schools will be closed as a precaution, but other schools are still open. What do we do about to prevent infections in schools? And are children still a concern according to you?
Yes, prevention in schools had to be done by following the school-led norms and proper distancing of the seats. The staff of the school has to be properly vaccinated. The bus staff and the children who are being handled by the staff other than teachers in the school have to be duly vaccinated, supervised, and wearing masks or observing COVID appropriate behavior. Because these children, if they bring infection back to the elders at home and back from the school to the home, would be a very meaningful, important segment of the spread of the COVID again. And this should not have happened actually. The way we were vigilant, the way we were discussing all these problems before opening the schools. But school had to open, so the schools had opened. And now, what will happen now is that after the opening of the school, in the younger and smaller children, the infection had gone, and this infection is going to the homes. And luckily, this infection is very mild. So this is the point of relief, and this infection is being controlled without admission in the hospitalization.
Right. Dr. Wali, stay with us. I'm also being told we are joined at this point by Dr. Anil Arora, gastroenterologist, Sir Gangaram Hospital. Dr. Arora, can you hear me?
Yeah, yeah.
Dr. Arora, we're of course discussing the mask mandate. We've been discussing, of course, various issues with Dr. Wali, but let me begin with the mask mandate. Was it a wise idea to do away with the mask mandate in the first place, Dr. Arora? And how do you react to now states and certain districts once again bring back the mask mandate looking at the rising cases?
Yeah, I think that is a very pertinent question. There are two aspects to mask mandate. One is a compulsory mandate by the government of India with policy of finding people who do not use the mask. That is a coercive technique. Second is a education on the part of the general public and laymen regarding the utility of mask. But if you see from government's point of view, before this new variant popped in, certainly the cases were declining, and most of us had seen a persistent downward trend. So that decision was not wrong. But I think we should understand as laymen also that till WHO declares the whole world free of epidemic, or government of India declares there are no more cases, using a mask is still a good technique because this is the cheapest and most effective way of controlling the disease, especially in the pediatric population where the disease transmissibility is more and where vaccination is minimal and where you do not expect the children to follow the strict rules as mandated by the government. I think since there is a resurgence of the weight, we should go back to increasing our vaccination and continuing with the mask with persuasion rather than finding them again.
Yes, Dr. Arora, stay with us. We're also being joined at this point by Dr. Naresh Chawla, National Joint Secretary, IMA, and Vice President, Delhi Medical Council. Masks or no masks? What is a good or better idea, Dr. Chawla? This is a debate which has broken out, not just in India, but world over.
In my opinion, till, as Dr. Arora said, WHO declares that the pandemic is over. It is a fault of Indian government now, and I clearly remember a couple of months back, around 6 months back, even US government also declared that they need not apply a mask. All those people who had taken all the 3 vaccination doses, but they reverted back. As far as mask in India is concerned, as we all know, India, most cities including Delhi, Calcutta, Mumbai, Bangalore, all of them are highly polluted. So mask not only will save us from the impending corona, but many other respiratory diseases also, pollution also. I think mask culture should become a general culture. And mind it, brother, even in Japan, they use mask just uniformly all the year, all of them. So I think we also adopt this culture, except for a little being cumbersome and little uncomfortable. But you may take off your mask when there is nobody around, say a couple of meters around you. But when you are in public, at any public place, in my personal opinion, mask is here to stay, should stay. Government should make it practically obligatory without imposing penalties, but by persuasion and by public health education, mask should be made a must for a couple of years from now.
Absolutely. And as far as, of course, now the spike in the cases in Delhi are concerned, Dr. Arora, how do you react to
Yes.
them? What is the cause?
Yeah, I think this was expected. If you look at the minuscule pediatric population which has been vaccinated till now, and the enormity of the school children we have in terms of sudden opening of not only the schools but also the malls, cinema halls, and the public places. After all, it is an interaction of the children with their parents also. If everybody is roaming around with a substantial chunk of the pediatric population not vaccinated, so this was not unexpected. Especially we are dealing, if we understand that we're dealing with a perfidious virus which has an unusual tendency to bypass all the norms of immunity and try to tweak and mutate itself. So we are dealing with a perfidious virus. So we have to be on the guard. So this was not unexpected, but I will agree with Dr. Chawla that we should continue to wear the mask rather than trying to force a fine onto somebody. If on long-term basis, as he has given very rightly the example of the countries like Japan and South Korea, which even in the absence of the pandemic have a good tendency to wear the mask whenever in public places, it will go a long way, not only in overcoming the present wave, but also in preventing the respiratory tract disease infection. And I think, Uday, you will agree with me. Recently, we were told that India is the biggest hub of tuberculosis in the world. Moradabad and Delhi are the city with the highest prevalence of tuberculosis. So masking by education, by convincing, and by coercing will do a much better job than having a very restrictive fines on the individuals.
Your take, your opinion, sir?
Am I to answer, sir?
Dr. Chawla, the rise in cases in Delhi, sir, what do you attribute it to? The new variant of XC, people shunning COVID-appropriate behavior, lifting of curbs, what should be attributed to?
You see, Delhi, public health-wise is just horrible. Just horrible. I'm in practice for last 40 long years in Delhi. Respiratory diseases, all kinds, including tuberculosis, asthma, allergic rhinitis, all kinds of diseases are in abundance. And as was added to it, the burden of this corona and corona-like diseases.
Yes.
It is hellish what people
Dr.
are
Chawla,
carrying.
stay with us. We're also being joined at this point by Dhan Singh Rawat, Uttarakhand Health Minister on the broadcast. Dhan Singh Rawat जी, बहुत-बहुत स्वागत है आपका. क्या मेरी आवाज आप तक पहुंच रही है?
बिल्कुल जी, मैं सुन रहा हूं.
धन सिंह रावत जी, मैं आपसे पूछूंगा कोरोना की स्थिति के बारे में. उत्तराखंड में अभी वर्तमान की कोरोना की स्थिति क्या है?
देखिए, अभी हमारे प्रदेश में एक तो बड़ा काम वहाँ की वैक्सीन की पहली डोज 100% लोगों पे लग चुकी है. सेकेंड डोज भी हमारे यहाँ 96% से ऊपर के लोगों पे लग चुके हैं, पूरे आबाद जो वो थे हमारे राज्य में. और जो हमारे यहाँ 60 साल से ऊपर के लोग हैं उन पे भी लगभग 65% लोगों पे जो है, जो हमारी तीसरी डोज है वो भी लग चुकी है. और अभी हमारे यहाँ थोड़ा नियंत्रण में है स्थिति. 6-7 जिलों में तो हमारे यहाँ 0 केस है अभी. लेकिन अभी 2-3 दिन से थोड़ा सी 3-4 जिलों में थोड़ा अभी 2-2, 4-4 केस आने शुरू हो गए हैं. तो मुझे लगता है कि इसके लिए कल ही हमने बैठक की है कि हमको अपने राज्य में अभी से एहतियात रूप में बरतने चाहिए. आज मैंने शिक्षा विभाग की भी बैठक की है और मुझे लगता है कि कहीं ना कहीं थोड़ा अब सुगबुगाहट शुरू हो रही है
जी, क्योंकि हम देख रहे हैं कि देश में भी जो नंबर्स हैं, कोविड मरीजों की संख्या है वो बड़ी है कुछ दिनों से. ये देखते हुए क्या आपको लगता है कि कुछ निर्णय आप लेने जा रहे हैं अगले कुछ दिनों में? क्या मास्क मैंडेट जो है वो उत्तराखंड में लौटेगा? हमने देखा है उत्तर प्रदेश में, चंडीगढ़ में, हरियाणा में मास्क मैंडेट जो है वो दोबारा लौटा है. मास्क को अनिवार्य कर दिया गया है कुछ जिलों में. क्या उत्तराखंड में भी इस पे चिंतन होगा?
देखिए, निश्चित रूप से आज मैं स्वास्थ्य विभाग की बैठक कर रहा हूं अभी 5 बजे से. और कुछ कैबिनेट के लिए हम एक प्रस्ताव बना रहे हैं. मुख्यमंत्री जी की अध्यक्षता में एक बैठक करेंगे और फिर इस पे निर्णय लेंगे कि हमको कहाँ कंटेनमेंट जोन बनाने हैं या मास्क जरूरी कहाँ है, स्कूलों के लिए क्या क्या नए SOP जारी करनी है. तो ये सब पे आज विचार किया जाएगा.
अभी टीकाकरण की क्या स्थिति उत्तराखंड में चल रही है? हमने देखा है बच्चों के लिए भी शुरू कर दिया गया है, बूस्टर डोज, प्रिकॉशन डोज भी दिया जा रहा है अब बुजुर्गों को और अन्य लोगों को। टीकाकरण की स्थिति क्या है धन सिंह रावत जी?
देखिए, मैंने पहले कहा कि हमारे यहाँ पहली डोज 100% लोगों पे लग चुकी है, सेकेंड डोज हमारे यहाँ 96% लोगों पे लग चुकी है, और बूस्टर डोज भी हमारे यहाँ 60 साल के ऊपर के लोगों पे लगभग 65% पे लग चुकी है। जो 18 साल से और 60 साल तक के लोग हैं उन पे अब लगना शुरू हो गई है। तो हमारे यहाँ जो वैक्सीनेशन का काम है वो काफी तेजी से चल रहा है और सब लोग इसमें बहुत कोऑपरेट कर रहे हैं।
जी, अगर बात की जाए धन सिंह रावत जी अस्पतालों की, तो क्या इंफ्रास्ट्रक्चर तैयार है? अगर केसेस बढ़े, अगर बढ़ोतरी देखने को मिले उत्तराखंड में भी, और अगर ये फोर्थ वेव की बात करें, अगर ये चौथी लहर आए हमारे देश में, तो क्या अस्पताल जो हैं और अन्य सुविधा तैयार हैं?
निश्चित रूप से अगर चौथी लहर अगर आती है तो हम पूरी तरह से तैयार हैं। और आज 5 बजे मैंने अभी तुरंत बैठक रखी है, सारे मेडिकल कॉलेजों को बुलाया, उसमें स्वास्थ्य विभाग की बैठक रखी है, और मैं अपने उत्तराखंड के हर नागरिक को आश्वासन देना चाहता हूं कि स्वास्थ्य विभाग जो है पूरी 24 घंटे आपकी सेवा में उपलब्ध है, और मुझे नहीं लगता है कि कोई दिक्कत हमारे राज्य में होने वाली है।
धन सिंह रावत जी, बहुत बहुत शुक्रिया हमारे संग जुड़ने के लिए। उत्तराखंड के स्वास्थ्य मंत्री धन सिंह रावत जी जुड़ रहे थे हमारे संग न्यूज़ एक्स पे एक्सक्लूसिव। मैं इस वक्त बाकी डॉक्टर्स को भी धन्यवाद देता हूं जो हमारे संग जुड़े।
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.